Hi, I am Jennifer.
I'm Lucia.
I'm Alexis.
I'm Jessenia.
And I am Roy. Welcome.
Our project is on HIV.
We hope to inform and entertain.
So please sit back and enjoy.
Now, let me tell you what is going on. Alexis and Roy met 2 nights ago at a friend's party. This is their first date. Alexis, you look amazing. I have really been looking forward to us getting together.
Thank you. I appreciate the compliment. You look pretty handsome yourself. I am having a great time.
I am glad to hear that.
Roy, I hope you don't think I am being too forward, but I must tell you that I find you to be extremely attractive.
Is that right? Please continue.
Well, I don't normally do this, but I would like to be with you tonight. I hope you don't think I'm easy.
Of course not.
I do believe in being safe. So do you have protection?
Yes, I have some at home. Either way, you do not have to worry about me. I am clean. After all, I am a doctor.
That is great to hear. Do you live nearby?
Yes, I do. If you are ready to go, we can leave now.
Yes, I am ready to go.
Sadly, little does Alexis know that Roy is also a very promiscuous person. Roy sleeps around a lot and often has unprotected sex. HIV is greatest contracted from heterosexuals. Unfortunately, Alexis is about to learn this lesson the hard way.
Alexis, welcome to my humble abode.
Not bad. You're pretty neat for a straight guy.
And don't you forget it, either.
That was funny.
The bedroom is this way.
Okay, let's freeze frame here. I don't know about you, but I don't want to see this. Needless to say, Roy did not have any protection and Alexis still slept with him anyway. Thus, 2 minutes later.
What do you mean 2 minutes later? I am sure you meant to say 2 hours later.
Well, let's just say, once it was over, they both went their separate ways.
Now, here we are a month later. Alexis is here at the doctor's office. She started experiencing flu-like symptoms, fever, fatigue, swollen lymph nodes, which is often one of the first signs of HIV infection, diarrhea, weight loss, cough and shortness of breath. HIV weakens your immune system by destroying important cells that fight disease and infection. HIV can hide for long periods of time and attacks your T cells or CD4 cells. That means, once you have HIV, you have it for life. Okay Alexis, let's go get you examined.
Dr. Jennifer, I'm really worried. I have never felt like this before, and I can't seem to shake this cold.
I am very sorry you are not feeling well, Alexis. Now, I do have some concerns. Your symptoms are very consistent with a virus that attacks your immune system. I have some questions and I need your honest answers. Okay?
Okay.
So, Alexis, have you been sexually active in the last 90 days?
Well, about a month ago, I did have sex with this guy named Roy.
Okay, was there anyone else?
Well, now that you have mentioned it, about 2 weeks before that, there was a guy named Michael?
Anyone else?
Yes, about a week before Michael, I slept with a guy named Frank.
Based on Alexis's signs and symptoms, and her history of numerous sex partners, the doctor decided to order some blood work tests, to see if Alexis may have contracted HIV.
Alexis, the test results have come back conclusive. You have contracted HIV.
The doctor tries to console Alexis. The doctor leaves Alexis, to prepare the information and medical prescriptions Alexis will need. The doctor sends nurse Lucia to answer any question that Alexis may have.
Alexis, I realize all of this has come as a shock to you. We're here to help you understand it all. Do you have any questions?
Yes.
As nurse, Lucia answers Alexis's questions. We have provided a questions and answer segment to our project. We hope that you find it informative.
What is AIDS? What causes AIDS?
AIDS stands for Acquired Immunodeficiency Syndrome. An HIV-infected person receives a diagnosis of AIDS after developing one of the CDC-defined AIDS indicator illnesses.
How long does it take for HIV to cause AIDS?
Since 1992, scientists have estimated that about half the people with HIV develop AIDS within 10 years after becoming infected. This time varies greatly from person to person and can depend on many factors, including a person's health status and their health-related behaviors.
Can I get HIV from kissing on the cheek?
HIV is not casually transmitted, so kissing on the cheek is very safe. Even if the other person has the virus, your unbroken skin is a good barrier. No one has become infected from such ordinary social contact as dry kisses, hugs, and handshakes.
Why is injecting drugs a risk for HIV?
At the start of every intravenous injection, blood is introduced into needles and syringes. HIV can be found in the blood of a person infected with the virus.
Is there a connection between HIV and other sexually transmitted diseases?
Yes, having a sexually transmitted disease can increase a person's risk of becoming infected with HIV.
Are healthcare workers at risk of getting HIV on the job?
The risk of healthcare workers getting HIV on the job is very low, especially if they carefully follow universal precautions, such as using protective practices and personal protective equipment to prevent HIV and other blood-borne infections.
What if I test positive for HIV?
If you test positive for HIV, the sooner you take steps to protect your health, the better. Early medical treatment and a healthy lifestyle can help you stay well. Prompt medical care may delay the onset of AIDS and prevent some life-threatening conditions. There is much you can do to stay healthy. Learn all that you can about maintaining good health.
Alexis is following all of her doctor's instructions. She has changed her lifestyle to a more healthy one. At the moment, she is even contacting all of her former lovers, just to make them aware of her health status, and to get them to get a health checkup.
Well, folks, that concludes our project.
We hope you have enjoyed it.
As well as picked up some useful information.
Always remember, safe sex first. Take care!
We almost forgot our references.